Setting: Hospital Diabetic Clinic. A patient is 60-year-old type 2 diabetic who has presented to the clinic with severely infected foot along with lots of redness and swelling. Now let's see the task. First one says ask about the details of the cut. Second one says explain the patient has left it very late to seek the treatment and this can result in ulceration and possibly amputation. Third one says reassure the patient that the appropriate medical care will be given to treat the infected cut, dressing and antibiotics. Fourth one says explain the importance of proper fit shoes to avoid friction, stress and pressure sores. Then finally it says give instructions about essential foot care for diabetes. Inspect their feet daily. Look for signs of cut, blisters or swelling. Keep feet clean and dry, especially between toes. Keep the toenails trimmed and cut across the toenail. Change the socks daily. Now let's get into this role play. Hi, good morning. I'm Margaret, one of the registered nurses working in this hospital diabetic clinic. I can see you more worried today. What's troubling you?
Good morning, nurse. I'm very much worried about my foot, which got infected so badly.
I'm really sorry to hear that. Try not to be worried. You're at the right place. We are here to help you. Okay, please tell me your name and age for documentation.
I'm David and I'm 60 years old.
Okay, David, can you please elaborate me what happened exactly so that I can understand your condition much better?
Sure, nurse. I got an injury on my left foot almost 2 weeks ago while I was gardening. Unfortunately, I could not consult a doctor. I was a little busy. Now I can see it is more swollen and infected along with some redness on it. I'm really worried now. I don't know what to do.
I completely understand your situation which you're going through. I know it must be really challenging for you, but do not be worried at all. This can be completely treatable. Okay, David, before moving further, may I ask you some questions in order to understand your condition much better?
Sure, nurse. Please go ahead.
I understand that you're a diabetic. Please let me know how long have you been diabetic?
I have been diabetic for the last 10 to 15 years.
Are you on any medications?
Yes, nurse. I'm on oral medications.
Okay, David, would you mind if I examine your wound?
Okay, nurse. Please proceed.
Thank you, David, for sharing all this information with me. Based on my assessment and your explanation, I understand that you have been diabetic for quite a long time, for which you are on medication. Apart from that, you got an injury on your foot almost 2 weeks ago and you left it untreated until now, and it is swollen. Moreover, I can see some redness over there and it is severely infected. Am I right, David?
Yes, nurse. I was unaware of it and I'm extremely worried about this. How do we manage this condition?
Your worries are understandable, David. Please set your mind at ease. We have definitive management and some treatment modalities to manage this condition. I hope you follow me.
Yes, nurse. I understand that.
David, as you know, it is very late to seek the medical treatment because he got this injury almost 2 weeks ago. As you are aware that you are a diabetic, it is highly important to get the medical attention immediately when you get an injury like this. So, if you do not get treatment on time, it may lead to worsening of the situation and significantly increases the risk of infection if an untreated wound becomes infected. So, if you leave it untreated for a long time, it can cause ulceration and it may also lead to amputation of your foot. So never leave your injuries untreated. Consult your doctor on time. Is that clear, David?
Okay, nurse. However, I was really not aware of it. What can be done now? Can this be treated properly?
I acknowledge your worries, David. Try not to be worried. We can treat your wound perfectly. That is, I can clean it properly and provide a better dressing. Along with that, you need to follow certain antibiotics and medications as per the doctor's advice. Apart from that, it is also important to wear proper shoes which is fit to avoid friction, stress and pressure sores. It is also essential to wear shoes that fit well. Wearing shoes that are too small or not wide enough can cause blisters which could turn into ulcers that become infected. Is it okay, David?
Okay, thank you, nurse. But I have a small concern. I'm a diabetic. May I know how does it affect The healing of the cut on my foot, or why there is a delay in healing my wound. I don't really understand that.
Okay, David, your concerns are reasonable. Patients with diabetes, even a minor cut can turn into a very serious problems if it is not treated properly because they have very poor blood circulation. When blood circulation slows down, blood more slowly, which makes it more difficult for the body to supply nutrients to wounds. As a result, the injuries heal very slowly or may not heal at all. So it is very much important to get medical attention immediately if you get any kinds of injury or cut. Is that clear, David?
Okay, nurse, thank you.
Apart from that, I would also like to give you some more instructions for your diabetic foot care. Is it okay with you?
Sure, nurse. Please proceed.
Thank you, David. First of all, it is important to inspect your feet on a daily basis to see any signs of cut, blisters or swelling. And if you notice the same, get the medical attention immediately. Apart from that, it is a good practice to keep your feet clean and dry always, especially between toes. Never leave it to get infected. And it is recommended to keep your toenails trimmed and make sure to cut across the toenail. And do not forget to change your socks on a daily basis in order to avoid any kinds of infection. I hope you're clear now.
Yes, nurse.
Okay, David, eating well and staying active are essential for staying healthy with diabetes. By having a good diet and staying active, you can control your blood sugar and keep it at the right level. To manage your blood sugar, you have to make sure that what you eat and drink matches your physical activity and any diabetes medicines you take. It is important to pay attention on your sugar level and your lifestyle. Do you have any more questions and concerns?
No, nurse. Thank you very much for your support.
I would like to recap what we have discussed so far. Until now, we have been discussing regarding your infected foot and its further management. I hope you understand that. If you have any more questions, you can contact me at any time. I'll be glad to assist you. Now, you please be seated here. I'm going to make more arrangements to dress your wound. Meanwhile, if you have any questions or concerns, you can ask me. I would be glad to help you. Thank you, David, for visiting our hospital diabetic clinic. I wish you a faster recovery. Thank you all. Our role play and see you.